It's Dr. Whitfield, and welcome to my Breast Implant Illness Podcast. Today's question that we're going to look into deeper is, are there any risks or complications associated with breast explant surgery? So breast explant surgery is performed for a variety of reasons, most commonly in my practice for breast implant illness. It can be obviously performed for somebody who's tired of having their reconstruction, just wants it taken down, wants to go back to a natural result, or a breast cancer patient who's flat. I've had a experience in all of those, relatively large experience, obviously, in breast implant illness. Risk and complications associated with explants are basically the same with implants, with a couple caveats. There is an incidence of entering the chest cavity, which is called a pneumothorax. In augmentations, it's low. Personally, I've done over almost 1,200 explants at this point, and that instance where you get a pneumothorax has happened to me in 5 cases in, almost 1,200, explants. So super low incidence. And I haven't had a hematoma, which is the next thing that I would actually be more concerned about, which is bleeding. And I haven't had one of those in several years, actually. So all those things should be low. And a skin infection, super low. I don't drain people anymore. I haven't had an infection due to drains in over a couple of years, obviously. And I've had one person get an infection when I haven't used drain in an explant only case, and had one other infection. So that's super low as well, given how many I do and how high volume practice I have. So it's always bleeding, infection, scarring. All right. So, scarring going to happen because you're reopening an old scar, or you're revising a lift scar, or you're making a lift scar. So scarring is part of your, genetics, but typically when you're taking things out, there's less scarring after because there's less pressure because the implant's gone. So there's weight, there's less expansion of tissue. Tension is one thing that really promotes scarring. All right. Is there asymmetry that can happen? Sure. I mean, everybody in the world has asymmetry. 95% of the breast folds are not symmetric. They're not at the same level. They're about a centimeter apart. Most people don't have the same size breast. And certainly that's why they got breast implants sometimes, because they're not the same size. They want more symmetry. They wanted enhancement. So obviously taking this out doesn't satisfy that in terms of aesthetic. So when it's like that, I'm always trying to look for answers for these, issues. And I feel fat transfer helps with some of these aesthetic issues. So that's something I do commonly. And then, can you have poor wound healing? That's really subject to how we optimize patients. So I don't really see that in my practice. I work very hard with diets, supplements, other testing to optimize and lower inflammation, optimize hormone levels, enhance recovery, anywhere we can. In terms of other factors that can be problematic, I think low BMI patients who have big implants are the most difficult patients. They have more breast sagging or drooping, long term. I feel like those patients would be optimized if they could be with a fat transfer, because they're low BMI. It's really hard to find enough fat. But even my clients who are low BMI, we get them optimized. They can have a delayed fat transfer awake in the office under local anesthesia, which sometimes is better for them. So I feel like that's an option that is utilized and becoming more and more utilized. Big implant in a patient that it doesn't fit their frame. So you're doing a lift. Maybe they can't, have a transfer. So they've got that body image change that they've got to work through. And we try to provide as much support as possible for that. The kind of baseline medical issues I've dealt with, lots of problems with lots of different issues, cardiac issues, pulmonary issues, which obviously for us are concerning in surgery, but we've worked through those and got patients to a point where they can undergo their procedure safely and recover comfortably. Even if they're coming from out of state, they'll stay here for about a week in Austin. And I've operated on a range of clients, as young as in their 20s and as late as in their, 80s, really. And so that wide range of health and overall age has become independent in terms of us taking care of patients. To minimize any risks or complications, we do all of the testing through my heart program, optimization with supplements, diet, treatments, lymphatic massages, if indicated, peptide therapy, if indicated, IV therapy, whatever we can do to support the patient, we do. Because it is a large decision to undergo explant surgery, one to provide the best possible setting for them. So we always want patients to pick their explant surgeon carefully. If they can't come visit us in Austin or have a virtual, we know we can't take care of everybody. I'm limited by how many, I can care for at one time, but we have a large network to help and provide support. We want everybody just to get the best care possible. So always, seek out a qualified surgeon, make sure they're doing explants routinely and they understand the ramifications as I've discussed them on my shows. And wish you all the best on your healing journey.